A New York City radio host is warning people about getting one of the most popular kinds of cosmetic surgery that's out there, breast implants. She says she suffered from rashes, joint muscle pain, and even heart palpitations after getting the procedure.
Yeah, NBC News medical fellow Dr. Akshay Sayal looked into the symptoms, which are being described by many as breast implant illness. And we do want to warn you, this story includes images that some people might find graphic.
49 seconds before we crack open the mic.
Radio personality Marissa Gonzalez, better known as Lala, goes on the air to talk about entertainment, music, and culture with her co-host and twin sister, Lulu.
35 KTU, the beat of New York.
But these days, she's talking about something else.
I've been sharing my story about explanting and
explant surgery, or the removal of breast implants. Breast augmentation is one of the most popular kinds of cosmetic surgery, but its history has been fraught with legal challenges and even temporary suspensions of the procedure over possible health issues. After her surgery, Gonzalez says she began developing symptoms like rashes, joint and muscle pain, and even heart palpitations.
I went to a dermatologist, I went to an allergist, I threw out all my makeup, all the brushes. It wouldn't go away.
The FDA, which has approved saline and silicone-filled implants, says that they're monitoring and researching symptoms similar to Gonzalez's, described as breast implant illness. But the agency doesn't recognize the illness as a formal medical diagnosis, and that's left many patients without answers.
I felt like no doctor was taking me serious. They were like, it's going to heal, you're fine.
But breast implant removal is becoming more common. Between 2006 and 2019, there was a 30% increase in these kinds of surgeries, according to data from the American Society of Plastic Surgeons. Dr. David Rankin, a plastic surgeon, once did hundreds of breast augmentations a year. Now, he focuses on patients who've had problems with the implants.
We see a lot of patients with thyroid issues. Joint pain is a big one, hair loss, brain fog, just generally tired, lethargic, not feeling themselves. There's theories that it's just a foreign body and your body's fighting against it. The real bottom line is, at this point, we really don't know.
Dee Hicks is a patient care coordinator for Dr. Rankin. She and other advocates have been pushing for the FDA to further acknowledge risks linked to augmentation. The agency issuing its strictest black box warning in 2021. But Hicks says the work is not over.
I see the suffering every day. I see people lose their jobs, their relationships, their health.
After months of feeling unwell, Gonzalez set up an appointment with Dr. Rankin to have her implants removed.
I'm finally here at Dr. Rankin's office.
How many days, weeks after did it take to kind of get better, or was it?
For me, it was immediate. I just felt like it's like a second chance of life. I'm happy that I can share my journey to help all those women that are probably feeling the same thing I was feeling.
I'm so glad you did this story, Dr. Sayal. It's so important for women to know. How long did she have her implants? Has she had her implants out for? And did she notice results right away?
Yeah, here's the cool part, Vicki. She got her implants out earlier this year by Dr. Rankin, who was a surgeon you just heard from. And what she tells us, almost an immediate fix. I mean, she woke up from that procedure, she tells us, with a smile on her face. Of course, she had the drains in place from her surgery. But she woke up feeling so much better. She woke up feeling so much more optimistic, so much more positive about her outlook and everything in life. And she said that her symptoms almost immediately just better.
Wow. We were talking during the commercial break, asking you a ton of questions, because I think a lot of people have questions about, like, what kind of implants, what are the risks? Because we've for years talked about potential side effects. So what are the risks?
Yeah, so generally speaking, you know, there's breast implant illness, which we just talked about, which is not a formal medical diagnosis, but you hear patients complaining about fatigue and joint pain and muscle pain and even a rash, like you heard Marissa. But there's other risks associated with breast implants, and that's including things like lymphomas or cancers.
Oh my gosh.
We're even hearing things about skin cancer, a kind called squamous cell carcinoma.
Wow.
We're hearing about contracture, which is the scar tissue that can form, that can contract and make it really hard and uncomfortable. So those are some of the other risks as well. Of course, infection with any medical procedure, with any surgery, that is a risk as well.
So obviously, if you are experiencing this, talk to your doctor. Let's say a woman has implants and she, wants to get them out. What happens after that? Do you need some kind of reconstructive surgery? What does it look like? What does your body look like after you remove these implants?
Yeah, so the big thing you first said, talk to your doctor. You know, in hearing Marissa's story, she had to shop around a bit, get a second opinion. You know, from a doctor's perspective, we don't mind that.
Yeah.
It's okay to get a second opinion. You're not offending us. And if you feel dismissed by your first doctor, go out and ask a doctor, again, I'm not feeling well, this is what I'm having. But if you do want them out, it's a case-by-case basis. Some patients do tend to get a breast lift afterwards. You can get rid of that. Sometimes there's excess tissues, little extra skin there that you can get rid of. But it's really a case-by-case basis.
It's not an automatic, you have to reconstruct everything.
Right.
Okay.
That is good
so
to know.
interesting.
All right, NBC News medical fellow Dr. Akshay Sal, thank you so much for shedding light on this issue.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.